Hi, my name is Karen and I am a student in the practical nursing program, and today I will be showing you how to don and doff PPE. So to start things off, we're going to take our alcohol-based rub and perform hand hygiene with it. You're going to want to get the base of your palms and the outsides, interlacing your fingers, the thumbs, up to your wrists, and also the fingertips. And you're going to want to do this until it is all dry. So the first thing I'll be putting on is the gown. If your gown has strings at the top, I would tie it from the top first. But this only has it from the side, so I will be tying it on to the side. And then next, I'll be putting on my face mask. So I'm gonna grab it from the sides and not touching the outside or the inside. I'm gonna put it around my face. You're gonna pinch it at the bridge of your nose and pull down to cover your chin. Just like that. The next item I'll be putting on is protective eyewear. So I have goggles, but you can also wear a face shield if you do not have goggles. So I'll be putting these on, noticing that I'm holding them from the arms of the goggles and not in front of me. Lastly, I'll be putting on gloves, and these gloves will be going over top of the gown. So we are protected there. Just like that. And that is how you don PPE. In this next part of the video, I'll be showing you how to take off the PPE. So to start things off, you're gonna want to start with your gloves. So you're gonna want to grab underneath where it's laying on the gown, lift it. Now with this hand, you're gonna want to do the same thing, grab underneath the glove so you're not touching all the exposed chemicals on the glove. You're just gonna flip it inside out and then dispose of those in the garbage. At this point, you are gonna perform hand hygiene. So using your alcohol-based rub, you're gonna sanitize. Until it's all dry. Next, what you're gonna move to is the gown. So you would untie it from the back and then untie it from the front, making sure to not touch the actual gown. And then I like to shimmy a little forward and grab the inside of the gown, making sure you don't touch anything on the outside. And then you're just gonna wanna roll it up and then dispose of that in the garbage as well. Perform hand hygiene. The next item that you will be taking off is your protective eyewear. So I'm gonna grab it from the sides of the arms. Slowly take them off. If they're disposable, you would go ahead and dispose them in the trash, but because these are reusable, I would use a cabbie wipe to wipe these down and make sure that they're clean. Now the next part is optional if you want to sanitize your hands. If you think that they are dirty, for the purpose of the video, I will do it before removing my mask. Till it's all dry. And you're gonna wanna take it from the side, making sure you're not touching the actual mask or the bridge of the mask. So you're just gonna lean forward, take it off, and dispose of that. And then lastly, you are gonna provide more hand hygiene. If you think that your hands are visibly soiled, then you should wash your hands with soap and water. But hand sanitizer is also okay if you don't think that they are soiled. And there you have it. That is how you don and doff PPE. In this part of the video, I'll be focusing on my reflection. So what I believe I did well was showing the proper techniques of how to don and doff PPE. This is very crucial because when you're in a hospital setting and there's a breakout unit or you're just going into an isolation room, you must have proper PPE on before putting yourself into any of those situations. What I believe didn't go well in this video was the fact that my PPE was very large on me, so I was struggling during my movements to pick up items because everything just kept falling forward. So going in next time, definitely know that I should get PPE to my size so I'm not struggling with it being oversized and it hanging from the sides. One future modification that we can work on is educating patients and healthcare workers about the correct techniques of donning and doffing PPE. By doing this, it can reduce significantly the risk of contamination and infections, and it can also boost our confidence as healthcare workers when we're in a high stress situation at the hospital. And we will feel more confident when we know how to properly use these techniques.